Good afternoon, everyone, and thank you for joining us for the final webinar in our READI Community Engagement Series, Equitable Engagement, Developing the Pathway from Community Researcher to Co-Author. Before we begin, we'd like to share a bit about the CTSC. The Clinical and Translational Science Collaborative of Cleveland is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, Metro Health, University Hospitals, and the Lewis Stokes Veterans Administration Medical Center. We aspire to be a catalyst for high-quality clinical and translational research, both locally and nationally, by changing the culture and environment of biomedical research, sharing resources and expertise, and streamlining the research process to move translational research from bench to bedside and to the community. Today, we have a power-packed schedule with phenomenal thought leaders in the space of developing community researchers into co-authors and really creating those pathways and opportunities for them to do so. First up, we will hear from Dr. Sam Miles from the Queen Mary University of London and Dr. Alicia Renedo from the London School of Hygiene and Tropical Medicine.
Super, thanks very much, Dr. Thomas. So can you hear me okay? Someone gives me a wave.
Perfect.
Yeah, perfect. I'm just going to share my screen. So I'm just going to do it so that I can see my captions. Perfect. Okay, so you should be able to see my screen okay now. Okay, and I'm just going to move us over to here. So me and my colleague, Dr. Renedo, are going to talk a bit about rethinking authorship, equity, and co-production. And I wanted to add at this point, we absolutely do not think of ourselves as experts or the finished product. It's something that for us is an ongoing conversation, and we've got lots to learn. Often people ask us kind of for tips and insights, and we can give those, and we have ideas. We have as many questions as we have answers. So in that spirit, hopefully we can have some really interesting conversations today. So I'm just going to check my time. Okay, super. So first thing to say is I speak very fast and with a British accent, so feel free to tell me to slow down. If you have trouble catching what I'm saying, you wouldn't be the first. Alicia is much clearer than me. Then we'll be taking it in turns to do some slides. So thank you for sharing your space with us today and inviting us to speak. And I hope that folks among you will find what we share useful. We're going to happily take questions after the presentation, and we can have some discussion later on in the session. So Alicia, I'll hand over to you.
Great, thank you. I don't know if you saw my reaction when Sam said I'm much more clear. I'm Spanish and I grew up in Spain, so I have a very strong accent, and I also speak very fast because I'm from North Spain. So do stop me at any time or write questions in the chat facility if there is the option to do that. Do not hesitate to ask questions. Great. So in the next 10 minutes, we are going to talk about our approach to co-authorship in academic publications of work that has been participatory, that has been co-produced with communities and other stakeholders. We will talk a little bit about the paper that captures some of our thinking around co-authorship, where we kind of discuss how this co-authorship or co-production of knowledge with communities can be formalized through co-authorship in academic publications. And we are focusing on co-authorship of academic publications with experts with lived experience, in our case with patients, with affected communities, with carers of patients and service users. We'll share our experiences and discussions that we had with our collaborators about formalizing and recognizing community contributions and co-authorship of knowledge through participatory research. And we will emphasize our principles of dialogue and co-production in research.
Super. So me and Alicia, we're now at different institutions, which says a lot about the funding climate in the UK for higher education. Alicia is still at London School of Hygiene and Tropical Medicine, and I'm now at a medical school attached to Queen Mary University of London. But the reason I say that is we're still trying to collaborate and work together in depth, which is a group that I can send a link to in the chat, and you can also have these slides afterwards, which is a research hub, which is very much about community involvement, co-production, participation, and we call it depth, which means dialogue, evidence, participation, and translation for health. Often we talk about translation quite literally because so much of our work involves different language groups. So participation and working with underrepresented groups, and in particular marginalized populations, are the kind of thread that connects our research. And that goes for young people with sickle cell, which is something we've done lots of work on, to work more currently with Gypsy, Roma, and Traveller communities in the UK. And we try really hard to broker dialogue and co-production throughout all stages of our research with community members. And by all stages, we mean, properly scoping and early bid applications or grant funding opportunities, kind of networking with community groups, advocates, activists, to see what is most desirable to populations with whom we're working and communities with whom we're working. And we are not saying it's easy. You all, I'm sure, have expertise and experience in this area. We find it to be quite difficult. Often other parties are quite resistant. It's quite slow. It's quite expensive because we pay our collaborators what we feel to be a good equivalent rate. So we pay everyone for collaborative work that we do, and we request our funders to include those costs in research applications that we make. And we find that our work is often misunderstood by funders and governments, and what's relevant to this paper that we're going to talk a bit about in detail, journal publishers. And so that's why we also write about our experiences of collaboration and engagement as it's happening, and we tell other people about what's gone well and what hasn't gone well, so that hopefully others can also learn from the experiences that we have.
Thank you, Sam. So our first co-authored publication, peer-reviewed publication in an academic journal, was with experts with lived experience of living with sickle cell disease in the UK, or of caring for someone with sickle cell disease. And this was part of our project called This Sickle Cell Life, which was a participatory research project in which we examined the experiences of transitioning from pediatric to adult services, healthcare services for young people with sickle cell. And we looked at these experiences of transitioning in the context of also transitioning in other aspects of young people's lives, transitioning to adulthood. So we co-produced the project from inception throughout to knowledge translation with carers, patients, and clinicians. And then we co-authored a publication with patient representatives working in the project. I worked with them also in when we were applying for funding and when we were developing the idea for the proposal and refining the research design, the study design, etc. So from inception of the project. We've also just finalized a project in which we've worked with, as Sam said, with communities, Gypsy, Roma, and Traveller communities in the UK and migrant workers, where we wanted to co-produce knowledge about how these communities engage with the public health response to COVID, how they engage with testing, with vaccination, etc. And it has also been a very participatory project where we've engaged in dialogue throughout the whole research project with communities. And we've just heard today that one of our co-authored publications with members of the community has been accepted for publication. So we've been delighted. And with the sickle project, if we go to the next slide,
Sure.
Sam, I wanted to add that yes, it's slow and it requires lots of resources. And actually with the sickle project, we were very lucky that our funders really supported this and gave us the financial resources we needed to make sure that the relationships in the co-production were equitable, and our partners from communities were being paid for their contributions in an equitable manner. And so these photos that we have here are of one of the last participatory dialogues that we held as part of the This Sickle Cell Life project. It was at the dissemination stage, and we worked with stakeholders, healthcare providers, educational providers, stakeholders involved in the care and education of young people with sickle cell, and also with young people, to think about the implications of the research findings for practice and to co-produce solutions to improve care for young people with sickle cell. And what was very interesting is that through participation, sometimes there are unintended consequences where your partners take ownership of the findings of the work, and they take the work to other places, and they start advocating for changes to improve health services, drawing upon the findings from the research. So they help with the dissemination, and they help with the advocacy needed to improve care for young people. And this is what happened as a consequence of this event, where some of the participants went to other healthcare spaces to talk about the work and to advocate for changes. Thank you.
And we think that's exciting, right? Because we think, oh, good, these things take on a life of their own, and they're not kind of run by us. They kind of have their own momentum that goes out in different ways. So we love hearing about stuff that's happened from this project, from the most random podcast or sideways kind of thing. It's great fun for us. Okay, Elizabeth.
Yeah, very quickly, because we need to move on to you. So at the core of our participatory work and our participatory research are the concepts of dialogue and knowledge, and how we can co-produce new knowledge, knowledge that is more transformative and it has more impact, that is co-produced through dialogue with the affected communities, with dialogue with policymakers, stakeholders, etc. So we use what we call the depth approach to co-production of research. It's a participatory approach that we developed with service users over many years, but it's also informed by our own research, depth research into how participation works in practice. So we don't only do participatory research, we also research how participation, community participation, user involvement works in practice to improve healthcare. And we've written publications around theoretical aspects of, for example, participatory spaces, and how the opportunities we create for working with communities, how those spaces and opportunities might have characteristics that might limit how much voice people have, how much impact people have, etc. So our approach to co-production is informed also by our own research. And what we do is we engage in dialogue from the very beginning, when we start identifying the research, the problem and the research question, throughout to data collection, where we work with co-researchers from communities which are trained to collect data, and they work with us to engage with communities, and also they work with us in kind of the analysis stage, where we hold dialogues around the preliminary analysis of the data to discuss and the analysis, refine the analysis, and then later on we develop more dialogues with communities and other stakeholders like policymakers, or people who we think that we need to influence. We engage in dialogues with them to think about the implications of the findings for practice, so in the knowledge translation aspect of the work. And what is useful about this participatory component throughout the whole project is that it helps build ownership and ensures that stakeholders take ownership, and the work is useful, is relevant, and is quickly taken up by the key groups we want to influence. And we've written about some of part of this approach in another theory paper that is referenced at the end of the presentation. Thank you. I think now, Sam, it's your turn.
Thank you. So we're not making assumptions that co-authors, community partners necessarily want to be co-authors on academic papers, right? So we believe that academic publications are a currency, and we need them, right? We need good academic papers, and we need them to be cited, and we need them for promotion. We're not making an assumption that all parties should feel the same, because academic papers are a certain niche. We don't even know if they're the most effective way of communicating ideas, especially when it comes to co-production and community involvement. That said, they do have a currency, and we think it would be remiss to not think hard about the equity of the different parties involved in making stuff happen. So for so long, we've kind of assumed an extractive model, right, where really interesting research is kind of it's produced by the undefined who, and then we get the job of writing it up, packaging it, and sending it to kind of become part of an academic system. And yet, if people contribute to work, they should be cited in that work. But the narrow confines of what contribution looks like tends to be about writing and about academic collaboration and about kind of senior partners who call the shots and knowing English and having experience in writing academic journals. And so we want to think that if you're contributing, you should be recognized, and that recognition doesn't need to just be acknowledgements, which we think can kind of have a kind of gloss effect, that you acknowledge everyone and yet you stay in your research team as the people who is producing the knowledge object. So we are thinking all the time about widening authorship beyond necessarily written contribution. So I mean that we don't have to have written contribution to be a co-author on a paper. So plenty of people agree that you don't have to have written contribution to be part of a project. It's a little less popular, the idea that we believe you do not have to have a written contribution to be part of a written output. And lots of people don't like that idea, and I'll talk you through a few ways in which that manifests. But we also think that gift authorship has historically overrepresented certain groups, and often those are academic groups, senior people, people with positions of privilege, and often community input is underemphasized. It goes unarticulated in academic outputs that we make. So our rationale for kind of thinking of a new authorship guidelines was work that we were doing funded by UK Aid, which is its own complicated, very top-down, very kind of colonial approach to international aid and international working. And we think that, or we found that existing guidelines have not yet caught up with co-production practices. So guidelines for non-academic collaborators are often kind of not specified and not defined clearly in authorship guidelines. We like authorship guidelines. I think they're a very good way of promoting equity. ICMJE, COPE, and BSA were our starting point, and we think that these are three good examples of excellent practice with authorship guidelines. We don't think that they've caught up with the dynamic ways that people are working often with communities who have a lot of expertise and should be recognized as such. So it's a tricky balance for us because authors have often been understood in a certain way, and journals have a strict definition of authorship, but we have diverse contributions that we want to kind of prioritize. And so this is the paper on the left that prompted Dr. Thomas to contact Alicia and I. And we're very proud of this paper, and we think it's a good starting point. We don't think that we've got there yet, not least because it was the three of us in our team working through some of these ideas without this paper being able to be truly community kind of have a full community input. It was our experiences rather than a new project that led us to be able to kind of work through this. So ideally, we would get community stakeholders around the table to write this paper. That didn't happen because the funding was cut in entirety by the UK government, which we find very interesting and problematic because it's a sexual and reproductive health project in very marginalized groups, including refugees, LGBTQ people, young people, and people with disabilities in Uganda and Nepal and 2 more countries in future. And the whole project was cut. So this is one of our few outputs of a project that had a lot of work and not much to show for it. But I put a quote in here that I think is interesting and I hope translates or communicates what we're trying to get across here, which is that we think that equitable authorship is so important in public health and global public health and healthcare and medicine, and it chimes with our experiences of different kinds of expertise and also our issue with what expertise gets baked in and which expertise gets listened to. And often it's not a very wide picture, right? Often clinical expertise is prioritized. Often patients tell us how they feel and we don't listen. We don't formalize it. We dismiss it as being one person's experience or anecdotal rather than statistically significant. And we're still working through some of this stuff. So me and Alicia are still thinking about how else we can ensure that we recognize community contributions and co-authorship in the knowledge and health improvement solutions that we're co-producing with them. So this goes beyond and authorship of a paper, but this paper is about that chunk of the work, like how we might be braver in thinking about different ways of recognizing authorship. And this is what our guidelines look like. They're not exhaustive. They borrow heavily from other existing guidelines, but they are our attempt to kind of make more specific a recognition of collaborative working. Now, there's all sorts of ways in which these might not work, right? Being open about author order and transparent, I think it comes in a few of our points here, is the ideal. There's loads of reasons why PIs are scary. White, global north, wealthy professors have a kind of, power imbalance to the ways of working. So some of this is optimistic, but at least we believe that if we enter every project we ever do with a set of authorship guidelines that make explicit our approach and the importance of community involvement and recognition of that involvement as being an expert knowledge, then we are doing what we can. So, for example, we've done point 10 here, academic journal publication must be supplemented with publication of findings in other channels. So plenty of funders require that anyway, but we take that very seriously because, for example, we've been amazed at how our collaborative research travels on social media, not in academic publications, but in podcasts and TikToks and Twitter. And also media articles are, by dint of their nature, so much more accessible than academic articles. So we take very seriously that other formats for dissemination should hold equal merit with academic publication. And then finally, last few slides, so we don't take up too much time. Slow co-production is a concept we try and thread through our work, not always successfully. So co-production is slow, it's expensive, it's a lot of head scratching. It can lead to trying to work out what we have in common and how we work around issues that we encounter. But we think all of that is important. And we've written before, I put a reference at the end, we've written before about what we believe slow co-production can achieve with communities. We believe in prioritizing time and place and pace for quality relationships to develop. And we make that as a kind of provocation to the breakneck schedule that we normally operate on. Good community engagement, good community participation, amplifying lesser voices, that can't happen at breakneck speed with incredibly tight deadlines and limited funds. So we're always aware that when people ask us what our tips are, often our tips are really like, you have to have money, you have to have funders who believe in it and get it and can see what we all see as being the tenets to make this stuff work. And the aim always is to enhance dialogue between researchers and community members and patients to improve healthcare. And then I'm going to finish on this slide. This is a commentary they wrote for The Lancet, which has provoked a lot of debate, which we're happy about because we are talking in a wider sense about community involvement. But we think it's very important that we keep advocating for and working for co-authorship with communities and for how we can recognize collaboration meaningfully and in an equitable way. Researchers, clinicians, practitioners often hold power in research relations with communities. So inclusion is so vital to applied health research if we're going to make that health research positively impact people's lived experience. And finally, we've put some references here to give us a taste of our work. We've gone from Alicia's extremely clever theory stuff at the bottom there with some more kind of straightforward stuff or shorter stuff about slow co-production, but hopefully that gives you a range from which you might choose from or find useful. And that's it from us. Thank you very much.
Thank you so much, Dr. Miles and Dr. Renedo. This is wonderful. And next up, we have a pre-recorded presentation from Dr. Audrey Giles.
of the Algonquin Anishinaabe here in what is now known as Canada. I'm a settler scholar of. Hi there, my name is Audrey Giles. I'm a professor in the School of Human Kinetics in the University of Ottawa in Ottawa, Canada. Thanks so much for inviting me to speak about community co-authorship today. Unfortunately, at the moment, I am on a plane, and so I'm thus unable to be with you live. However, I hope that this short presentation will allow you to get a feel for some of the work that I have been doing. So in terms of situating myself, I live, work, and play on the unceded, never surrendered territories of the Algonquin Anishinaabe here in what is now known as Canada. I'm a settler scholar of English and Welsh descent, and my pronouns are she and her. And I conduct research with Indigenous peoples. So part of my commitment to being a person who lives on unceded Indigenous lands is that I think that it's important to make sure that our education system and that policy and practices reflect Indigenous peoples' lived experiences and their needs too. So while most of my work in writing about community has to do with Indigenous peoples, today I'll be talking about community as a broader concept. So I was asked to talk about community co-authorship today, and I think there are two different aspects to this. There's community members as co-authors, and then there are communities as co-authors. So community-based participatory research, also known as community-based research or participatory action research, involves community members' inclusion in all aspects of the research process. So this means that it's supposed to be from kind of research design, research conception to the publishing of it. It actually rarely includes co-authorship. So when my grad students and I were working on a paper that's about to be published, we wanted to look at why it was that community members were often not included as co-authors. And what we found is that researchers, stated that, community members were either uninterested, that authoring with them was too difficult, that it was not important to them, or that there was not enough funding. And I would argue that none of these are good enough reasons. Certainly the community members are interested in the work if they have done it to this point. In terms of being too difficult, I think we all know that there are many ways to mentor people within writing, and it is clearly important to them if they are involved, and if there's not enough funding to help them to conduct the writing process, then I would argue that the research never should have been done in the first place. Things get a little murkier, I think, when we look at the idea of communities or organizations as co-authors. So the question becomes, is knowledge individual? Does it belong to an individual, or is it shared? And I think this becomes particularly important when we look at things like traditional knowledge, and to knowledge belonging to Indigenous peoples or particular groups, and asking, who owns this knowledge? Is it up to one individual to share it? Can a group of people share it? Who is deemed part of the community, and who is deemed as being an outsider to the community? So in short, who can speak on behalf of the community? So if we say that a paper was published by, say, Giles and the municipality of Echo, that's one of my dog's names, then who in that municipality is actually speaking? And am I actually put in a position where I'm entitled to speak on behalf of people, or to even share knowledge that might be confidential or sacred? And are we actually reflecting shared knowledge when we use communities as co-authors, or are we silencing dissent? So for instance, if I say that this paper was co-authored by residents of the city of Ottawa, that makes it sound like everyone in the city of Ottawa would agree to having their names on this paper. Now, there are 1 million people who live in my city, and certainly many of them would disagree with me. So if I put the community's name on it, am I actually just silencing dissent? What happens to voices that don't agree with us? And this is particularly important to think of when we think about voices of people who experience marginalization. Are we just further marginalizing them when we use communities as a group author? Or is there a way of empowering people and making sure that we have consent from everyone who believes that they are part of this community? So I was given 5 minutes. This is 5 minutes on the dot. If you have any questions, please feel free to email me at agiles@uottawa.ca, or you can visit my research team's website at teamgilesresearch.com. Thanks so much.
All right, Dr. Cook.
Yep, I have now unmuted. All right, here we go. My name is Stephen Cook. I'm a fish ecology professor at Carleton University in Ottawa, Canada. I wear the hat of a fish ecologist, the official uniform today. And I have the privilege of joining you from the traditional unceded territory of the Algonquin peoples. Today, I'm going to talk about rethinking authorship, and the context for which I'm going to share is through that as a conservation scientist. So I study fish, aquatic systems, with a focus on conservation and sustainable management of our resources. And not surprisingly, much of that involves interacting with different individuals that traditionally are not part of academic papers. So that may be rights holders, for example, from Indigenous communities. It may be practitioners like a fisheries manager or an environmental decision maker or policy maker, or it might be something like a commercial fisher or a bird watcher. The traditional authorship criteria, which have already been introduced, tend to be derived from groups like COPE or ICMJE. And we usually think about the idea generation, data collection, analysis, writing, editing, and funding. Those tend to be sort of those core things that we think about. More recently, the credit, which stands for contributor rules taxonomy, was introduced. And the idea here is that this would allow scholars to identify more specifically what they brought to the table. Were they involved in supervision? Did they create or curate software? Were they engaged in formal analysis, or whatever the case may be? So you can link those very specific rules back to individuals. And as a conservation scientist, when I look at this list, there's many, many things done by key members of our team, either inside the academy or outside, that are missing from here and simply don't allow us to recognize those diverse contributions. So with a number of conservation scholar colleagues from across Canada, we came together and came up with what we thought a revised or expanded role of credit rules that would work better for conservation scientists. And we argued, as the title says right here, that contemporary authorship guidelines fail to recognize diverse contributions in conservation science research. Just to remind you a little bit, not unlike the medical world, this is a mission-oriented discipline or area of inquiry where we're focused on understanding and solving problems. These happen to be conservation problems. They tend to be complex, often wicked, transcending natural sciences and the social sciences. And so that demands different disciplinary perspectives. We also know that Western scientific approaches are failing. If we'd done an admirable job of reversing the biodiversity crisis and solving the climate crisis, then maybe we could stand up and sort of wave journal articles around as being the savior, but that's not the case. We can't do it alone, and we need the help of others, including thinking about other knowledge systems. And increasingly today, we're seeing that how one does conservation research, the process in which one engages in, is as important as the outputs. If that research is not done in a so-called good way, those outputs will be ignored or dismissed. And so I just want to walk through some of the examples of other roles that we think are appropriate and that we propose to be included in that taxonomy. And we think that that taxonomy could be expanded much further and perhaps more purposefully for the medical and healthcare field, for example. So the first we have up here is partnership development and consultation. In the image there, you see an Indigenous elder engaging in ceremony. This is creating the ethical space for when we came together at the Canadian Museum of Nature to come up with essentially a research prioritization paper for biodiversity conservation here in Canada. So that's but one example, but that individual, the elder, obviously earned authorship, and that was a key component, creating that space to come together and share. Of course, there's co-production. This has been spoken about already, and so I'm not going to dwell on this. But I did want to share an example. So this is from a journal called Facets. I happen to be on the editorial board, and they've been doing a lot of really good work and thinking about how to include communities, or in this case, a non-human entity. So this is from the Mi'kmaq people, and that first author refers to all my relations. Several of this, the second author there, Albert Marshall, is an Indigenous elder, and then a number of scholars and other folks from local communities. The journal is part of Canadian Science Publishers. That's the editor. And they wrote an editorial notice that accompanied that paper. And I think there's some really fascinating stuff in there. And so quoting here, the idea of community collectives and more than human actors being authoritative sources of knowledge as Indigenous concept that differs from Western science approaches to authorship and contributorship. And so this is part of our road to reconciliation, realizing that how we've done things tends to be in line with colonial approaches. And then in that sense, this follow-on, it only makes sense that determining how to attribute authors Indigenous knowledge should flow from their rights to own and control their cultural knowledge, data, and information. So again, connecting back to things like the UN Declaration for the Rights of Indigenous Peoples. For the kind of work I do, and in fact in the medical sphere as well, obviously one needs various ethical approvals, animal care. I need scientific collection permits from various government bodies, biosecurity clearances, land access permits, and so on. In that picture is Andrew Lotto. Andrew is a fisheries technician at the University of British Columbia. He's an ex-fish cop. And his key role in the team is to get us permission to do our work. That might seem like a trivial task. It is not. About 6 months of his year are spent securing those permits and reporting on them and maintaining the relationships needed so that we're able to do so. So just an example of a key individual, and he is, in this case, down as a co-author. Of course, there's the bridging and brokering roles, and these are people that we often think of as sort of after the paper is published. We'll bring these people to the table, and I think in the previous example from Dr. Giles, it was suggested that there and Dr. Miles and others that we need to be thinking about that communication piece as well, and in this case, ensuring that translation of knowledge from the peer-reviewed papers into the hands of decision makers. And so that was an example of an individual that we've done that with. And then in this case, that's Hedrick Wachelka. He's a retired individual, works for the volunteers to the local Muskies Canada organization, and he has been co-author on a number of papers in our lab. He has been absolutely critical to catching fish, to securing funding, and to ensuring that the work that we're doing is relevant. There's lots of examples about how to do this. And then finally, the last example I'm going to use here is my children. So during COVID, we were locked down just like everybody else. We were fortunate to spend much of that lockdown at our cottage. And so I recruited my children as my field assistants. You can see them there catching fish, tagging fish, entering data. And they ended up earning authorship. They were key to ensuring that this work happened. So maybe we need another tick box there for family science as well. So With that, I think it's time to revisit. We think it's time to revisit authorship criteria to better acknowledge the many ways in which individuals, communities, and other actors contribute to conservation science research. This paper is just a discussion starter. We don't pretend that we have this right, but we really wanted to get people talking. We know that determining who is deserving of authorship is a dynamic social process, and it will vary from team to team and context to context. And so we're hoping that this spurs more conversation, and I'm really excited about the conversation that we're having today. So with that, I will stop my screen share and thank you for your attention.
Thank you so much, Dr. Cook. And now the floor is open for Q&A from all of our participants. And if our presenters have any questions for the group, please feel free to place those in the chat or ask those aloud as well. We want this to be, a great conversation.
Hi, I just want to say that I really appreciate all of your talks. I had never really thought about involving the community members, and I haven't done a lot of participatory research. But even when I've been doing studies, like I've studied nurses and social workers, I wish that I could have gone back to them when I was in that writing process and gotten their input on what I was describing as their attitudes and their practices within the healthcare system. So I really appreciate all of your talks.
Thank you for saying that. And we agree that we think it's really fun and really interesting. Our challenge is the kind of baked in norms that we don't want to rock the boat entirely, but for us, we've had real problems with journals in particular saying the voice of these sickle cell people who are talking in a non-academic way or writing in a non-academic way feels anecdotal. It's like, well, we don't want to do academic journals that aren't academic, but equally what expertise gets lost if we are always channeling things in that kind of specific norm set.
There's a chat question or comment that I wouldn't mind seizing onto. And that's about the experience in navigating the logistics of having community members as co-authors and how that's reported to scientific journals. And so I'll throw on my editor hat here. I'm fortunate to work with a couple of different journals. And I think the reality is that all journals are different and all editors are different. And there's some dinosaurs and there's some journals that are stuck in the 1950s. And I think it's a matter of finding those frontier, more progressive journals and editors and sharing the information there. And then frankly, everybody else is going to follow. This is, I'll go back to what I said about, it's not just about the findings these days, it's about how those findings are generated and ensuring that that was done in a so-called good way. And acknowledging those involved and realizing that much of the kind of work that we're talking about here is not fast science. This is slow science, slow scholarship. And it's not easy. There's no, working with this many people and having, 50 or 100 co-authors, that doesn't expedite the science by any means or make the process any easier. But I think it makes that final product much more acceptable and usable and salient to those that were involved.
Thank you, Stephen. I totally agree with you with the slow science aspect of it. And also like from our own experience of like the journals kind of fighting back or like feeling like there is a specific type of knowledge and writing that has more status as a source of evidence. And I think, so it's about choosing the journal, but also like we felt like with some of our reviewers' comments that made the point that the voice of the community member who was a co-author that came in a very kind of individual way in the discussion and kind of was trying to convey the lived experience and how that lived experience connected to the findings. They wanted us to remove that because it was too subjective or too personal. And we decided as a team, no, we want it here because he's a co-author. And why would that have less status as a source of evidence? So I think we need to think, so these are all the kind of conversations you have in your mind and reflections around what counts as knowledge. We should fight towards making sure lived experience is recognized. Yeah, so yeah, I think that, yeah.
And I'll just add to that, I'm just remembering that one thing for anyone who's done this before, who's interested in doing it, is we learn very quickly you can't be precious about this kind of thing. So with the sickle cell project in particular, I often said, oh, we'll pay for some of your time to write notes that you'd like us to include in this academic article, or what section of this academic article would you like to write? Total non-starter, wasn't happening, very intimidating way of looking at contributing knowledge. So I spent a lot of afternoons on Skype or on the phone with people, with some of the patient experts saying, what would you like me to emphasize? Or I'm going to send you a piece of text that we've written as a section of results. We've talked about, I don't know, UTIs for young people with sickle cell. How does that sound to you? And getting them to say, yeah, and can you add this? Or that sounds good, but can you make sure they know that it's not just nursing stuff, it's or whatever. That's incredibly slow, very fiddly, and lots of like work from you. But it's not work from those collaborators or co-authors. It's just not a traditional sense of it.
Yeah, I mean, it's not the traditional way of co-authoring with others. It can be, but like the way we work between us, Sam and I, other co-authors working in a university, is you send the document. I mean, you have a meeting where you discuss the paper, and but then you work and you insert comments on a document, and you respond to those comments in a document, and you track changes and etc. But that might not be the way you work with a member of the community. And I think for us, it's very important to always have a very clear conversation with our collaborators about how do you want to be involved? What works for you? What is the type of activity that you want to be involved, and how do you want it to happen? Because not everyone might want to comment on a paper. Someone might want to have a conversation with you one-to-one or in a group with other. So it's about creating those participatory spaces that are enabling for their voices to be amplified, and for their lived experience knowledge to come into doing something together and influencing the work. But it's always, that's why it's slow, because you need to develop the relationship, you need to talk about what works for you, and then you need to create those opportunities. So it's a fantastic, Stephen, that you have someone as well allocated that spends so much time building and sustaining the relationships as well. It's a very good example of how many resources are needed in this work.
This is Becca Boss from Cleveland. Thank you all so much for taking the time to be with us today. I think the fact that Jalise had to go like literally around the world to find people to speak to this really shows how unique and challenging the space is. I dropped a question in the chat, but actually I'm going to flip it and start with my part 2 first. And I'm curious to hear a little bit about how you tackle compensation. We know that that's a best practice when we're bringing community researchers into our studies. And we're still trying to work through the kinks of how we make that happen in a way that honors their time and their expertise, because it's so different from the models that we see in an academic or a medical institution setting.
Sure. I'll jump in with one bit, and Alicia might want to talk about, well, I'll very briefly do it. In the UK, there can be complications with paying people cash, because it has implications for social security, which we call benefits. So receiving cash makes you earn, and not all of our community collaborators might be earning. So that can have complications. So we would normally offer cash or a gift card equivalent for high street shops. The good thing in health is that the NHS has a benchmark for involvement. I think it's something like £40 to £50 an hour, or £150 for a full day. And you can do a half day or a full day. And those are called the NHS NICE guidelines. So we can use them and say to funders who go, oh, this looks kind of expensive, we say, the NHS says that these are patient experts, and we're going to pay them like patient experts.
Yes, just very quickly before Stephen talks from his own experience. Yeah, we use the they are called involved guidelines, and they have information about how much you pay communities, and it's very useful for us because we just draw upon them when we want to put a budget together for a grant proposal. But the issue of cash and the fact that for some communities, it's very important to be paid in cash can be very tricky in universities because of the structures of the universities and the bureaucracies around paying in cash. It's been problematic for us. We've managed to do it, but I mean, there are so many things around the bureaucracies of payment that, yeah.
Yeah, the university administrators despise this, but in Canada, relatively easy to compensate and expected Indigenous community members, much more difficult to do so to other individuals. Many of the groups we work with, the community members are part of volunteer organizations. For example, I showed the individual with a big muskie, that big fish. So they're part of Muskies Canada. So we're sort of engaging with those organizations, and then the people sort of come to the table as volunteers from that, as opposed to it just being random individuals that we've recruited or found off the street. So that kind of they're not-for-profit organizations or just sort of volunteer-based organizations. So they sort of serve in that sense. So that part's a little bit different. But if we're doing anything with Indigenous community members or Indigenous governments, Indigenous governments can be, it depends. We follow the lead of their organization, whatever their rules are, as to whether or not their staff are paid on top of their regular salary or not. But this is challenging. It's difficult to just hand out money without a paper trail, and not all of the individuals will have they might not have tax registration if you're dealing with people that are impoverished or that are not citizens or whatever the case may be.
It was probably unrealistic of me to expect that you had like the golden ticket and figured all of this out. But again, I think it's really reassuring to hear that these challenges are universal, and we know it's best practice. And so I think that those of us that really want to see community researchers be part of studies is we will find a way, or we will make one. And it's not always pretty. It's probably pretty cumbersome more than anything else. But thanks for your insights.
There's one final grey area that when we work with NGOs or charity groups, if the staff member is a paid staff member of that group and they're doing it in their workday, then it might be that they're doing it as part of their job in their workday. We have found in our most recent project that those people say, I can do the evening. I'm not working for my job in the evening, to which it's like, okay, fine, let's do that. So people have their own thoughts about how this works, and they're often happy to explicate them.
Do we have any final questions?
If we have time, I'd love to play off the first part of that previous post that was in the chat there about any specific challenges or lessons related to training, orienting, or onboarding the community researchers to be prepared for this kind of thing. I think it's conversations and being clear from the beginning about what could come out of it. You don't always know there's going to be a publication, nor will there necessarily be a publication where it makes sense that they would be involved. But I think mapping out where it could go, what the possibilities are, and what those opportunities might entail, and then revisiting those as conversations along the way, I think that's productive and ensures that people know what could be expected, but also are kept up to date as reality sort of plays out in real life and things morph and change and so on.
Thank you, Dr. Cook. It looks like we have another question. Co-authorships could go beyond academic publications in the areas of applied research, such as strategic solutions of local concerns or policy awareness or modifications. And that is absolutely right. That's another one of our READI tracks. We talk about the impact of research on policy. Could you share your experiences with that, and how do you publish the lessons learned?
Alicia, I don't know if you want to speak about participatory spaces in healthcare settings, which I know that you've done work on. That's very exciting.
Yeah, I mean, we've researched, I've done a very long ethnography into how service users, patients, and carers are involved in quality improvement initiatives in the National Health Service in the UK. And through that ethnography, which was an observation of how communities, patients were working with frontline staff from hospitals, clinicians, and researchers to improve the quality of services, we developed some kind of evidence into how, their role they have in improving quality of healthcare services. So that was research done into understanding how it works in practice rather than us doing it. For the SICL project, we used findings from the research to inform knowledge translation. So a program that was being designed by the Sickle Cell Society, which is a national patient charity in the UK, a program and intervention to support transitions to adulthood for young people with sickle cell. So we had dialogues with them about how we could use some of the findings to inform the actual program, the intervention they were designing. So that's kind of what we've done in terms of the practical aspect. Yeah, that's it.
Definitely.
Okay, well, we just like to extend another hearty thank you to our new friends from across the globe. This is absolutely wonderful, the insights. And like you said, it is a continued learning process, and it will be iterative for us, those that are starting at the beginning, those who are kind of in the middle of trying to figure things out. But we look forward to reading future publications and maybe collaborating on something in the future, as I know that this will spark a lot of thoughts within our local community as we try to, like Becca said, continue to carve these pathways for our community researchers.
Brilliant. Thank you so much for having us, Dr. Thomas.
My pleasure. So what can you do today? You can schedule a READI consultation at spark.case.edu. Sign up to attend future programming and join our listserv so that you don't miss out on anything, and review our CTSC DEIA resources. We'll give you a couple of minutes, some virtual commute time to engage in meaningful activity that will help you commute back to yourself before your next meetings. Move, breathe, engage your senses. And that's from Dr. Jennifer A. King, the co-director of the Center on Trauma and Adversity at the Mandel School of Applied Social Sciences at Case Western Reserve University. Thank you so much for joining us, and enjoy the rest of your afternoon.
Cheers. Bye-bye.
Thank you.
Thank you so much.
It's been a pleasure. Thank you. Bye.
Thank you.